A very good evening and welcome to one and all present here for International Webinar Series on Dentopharm 2022 on understanding the research process. I am Dr. Ramya, part of Dental Education Unit and Senior Lecturer at Sri Balaji Dental College and Hospital, will be highlighting you about this program today. I would like to welcome our chairperson, Dr. Sri Nisha ma'am, Registrar Dr. Bhuminathan sir, Principal Dr. Jimson sir, and Dr. Sumati Jones ma'am, Head of the Department of Pharmacology at Sri Balaji Dental College and Hospital. Over to Sumati ma'am to share a few words on today's webinar.
Good evening. Today, as you all know, our international webinar series mainly explores diversified field of research and the latest research findings from eminent researchers from their respective field. So, today we have Dr. Hema Ramamurthy ma'am from John Hopkins. Ma'am is eminent in this research field. She'll be explaining in detail about understanding the research process. Over to Ramya about ma'am, please.
Just a little announcement on housekeeping before we get started. So if you have any queries during the presentation, please type them in the type the questions in the link provided in the comment box. After the presentation, we will have time for questions at the end. Now I warmly welcome the guest speaker of today's webinar, Dr. Hema Ramamurthy, who is Research Associate in Department of Epidemiology in the Bloomberg School of Public Health, Johns Hopkins University. She is an alumna of Dr. MGR Medical University, Tamil Nadu, Chennai, Texas Women's University, and Johns Hopkins University, USA. Dr. Hema Ramamurthy has a research career spanning over 20 years. She has directed research studies that aim to investigate best practices to intervene and prevent infectious and chronic diseases, including HIV risk reduction, self-management of hypertension, and epidemiological studies of chronic obstructive pulmonary diseases. She has recently shifted her focus to investigating the roles of technology in aging and age-related issues, including frailty, social isolation, and loneliness. Today, her presentation is titled Understanding the Research Process. She will share her expertise about the various phases of research project and provide you an example from her own work in understanding differences in smoking behaviors before and after COVID. We welcome you, ma'am.
Hello, everybody. Good evening. Thank you to Sri Balaji Dental College and Hospital for inviting me to provide this talk. And thank you, colleagues, for joining on a fine Saturday evening. I truly believe that you have other things to do, but you've taken the time to be here. And I want to help you kind of travel through this process of research. Research is kind of, especially if you're coming from a clinical background, is considered something very exotic and something like, mad scientists sitting inside a lab with mice and rabbit and trying to, inject them with drugs and find some results. But research has come a long way since then, right? From those times where we imagined those things. There's a lot of research done with human subjects, and my focus has always been human subjects research. So what I'm going to do today is to kind of explain what research is, understand a few processes, so that you kind of get a bird's eye view, because not many of us would have been exposed to research during our careers, during our academic education, right? So what do we have for today's agenda? So we'll go over what is research, identify some definitions, and we'll focus on identifying the problem, because this is hands down the single major thing that you need to understand while attempting to conduct research. Okay, and there is a different phases to identifying and answering the problem. We'll understand that. We'll go through some of the details. And of course, the skeleton, the absolute skeleton on which research stands is the methodology, right? What are your methods, which is very, very important so that your research has validity and is reliable, okay? So I know there's a lot of participants who have signed up for this, and I don't want to be the only speaker. If possible, if somebody can, if I throw out some questions, if people can respond, that'll be really helpful. Okay, let's keep this interactive so that we can get through this in a very smooth way and in an enjoyable way. Okay, so let's begin with what is research. Let me ask you something. So you and your friend plan on going your first skydiving adventure. Your friend asks you to research more about it. What is this? Is this research? In your understanding, in your current understanding, what is this? Can somebody answer? So now what this is it's actually information discovery, right? It is not actually a process of research as defined in academic research, okay? So then there is another type of work that is done. You're asked to write a research paper on harmful effects of not flossing after every meal. So what do? You start Googling about it. You look into some nice databases, scientific databases. You look at other people's work and you kind of collect it all in one paper and you write a report. Now, is this research? This, again, unfortunately, is not research. It's basically transporting data from one location to another. It was in various different articles, various different websites. You just gathered that all and you're presenting it in a paper. Then you read an ad which says, years of research have produced a new method to brighten your clothes or your car or whatever. It's an online ad. You immediately send out, you put a request for it. It's Amazon or whatever company is delivering it, delivers it, and lo and behold, it arrives. And it is nothing but another detergent, right? So what they've done here is they've used the word research as a catchword, okay? They've used catchword to get your attention because research is kind of thrown around in different contexts, but it really does not actually reflect what exactly is done in scientific research. So all of these are not research, right? So then what exactly is research? It is a very, very systematic process of collecting and analyzing data in order to increase our understanding of a phenomenon. There is some phenomenon that is happening. There are many phenomena, right? The sun rises in the morning, the moon rises in the evening. That's a phenomenon. It's the most common phenomenon that all of us share, right? There's rains, there's some people who are sick, there's many phenomena. But we don't have an understanding of all that goes into causing that phenomenon, right? What is causing this phenomenon? What is the reason that this is happening? So you have to systematically collect some data, analyze the data to see whether it explains that phenomenon. So the entire process of interpretation of the data is what is the main part of research. It is the fundamental idea behind doing research. Okay. Now, what is this process? We talk about a systematic process, right? Why should it be systematic? How do you go about this systematic process? So you have to identify an original problem, as they say, and problems already exist, but the problem is original to you in that you're trying to answer. There's no answer to it, and that's why it's an original problem. Then you articulate an overall goal in answering that problem. What are you trying to get to? Then you follow specific procedures. And of course, all of your work is based on certain very, very critical assumptions because all phenomena are not the same. Certain phenomena occur under certain conditions. So there's based on certain critical assumptions. And then you collect and interpret the data to understand this phenomenon, and you repeat the process. The reason you repeat the process is this journey of identifying the original problem to collecting and interpreting the data, if done correctly and systematically, accurately, will generate its own questions, and it will generate some new problems. When I use the term problem, it's the questions, right? So it's going to generate some new questions that you have to go back and answer. So research ends up becoming a cyclical process, One of the reasons that it has to be systematic is that the research that you do has to be replicable. If I follow steps 1, 2, 3, 4, and I publish about it, somebody else takes those steps and does the exact same thing, and they have to get similar results under the same conditions. So being systematic is absolutely critical and crucial in conducting research. Okay. Now, how do I go about finding an original problem? There's enough problems in my life, and now you want me to go and find some more problems, right? So in the professional setting, there's many avenues to answer some burning questions, right? Or even in your social settings, right? So the main way I would encourage, right, especially if you're early in your career, you want to get into research, or you want to conduct research just as part of completing your degree program, right? Read. The more and more you read, you observe, you read, you observe and you read. What you read, you come back and you observe whether is this true of in this world. If you read and there is a concept, does this concept actually apply to the world? Does it function the same way as it is told in this article or the textbook or whatever else you're reading, right? Attend professional events, right? Discuss with experts. Listen to podcasts, watch videos. I've listed certain podcasts like Radio Lab, Science Friday, and Hidden Brain, which I personally actually use. It's the very engaging discussions, and you actually learn about how to ask the right questions and how to answer these questions. What are these exotic questions? What are the unanswered questions, right? You learn the process through that. And of course, to read, we have many scientific databases that we can use. Depending on your institution, you can access PubMed, Ovid, EBSCO, Medline, and talk to your librarian. Whoever is helping your librarian in your library, talk to them about using keywords to search for information. You could be a dentist, you could be a cardiothoracic surgeon, you could be a cardiologist, an internal medicine physician, a nursing student. Within your area, you may have some interest, and that interest might come based on some interaction with a patient or something that's actually prevalent, right? That you hear about it in the news, or something has happened to a family member, or some disease that you could not cure. You have patients coming in and they can repeatedly come in and you don't know what is going on with them, and you've tried your very best to treat them. And then you can start asking yourself, what else can be done? How has this been answered? What has not been answered regarding about this issue, right? So the whole idea of getting into a research career, or even conducting a research project, is to have the curiosity to ask the question. And it's also very, very important that you critically evaluate others' research, right? When you're reading, when you're listening to a podcast, you have to critically analyze and understand whether what they are saying makes sense in an article. So I've provided a checklist when you read articles, right? You begin with reading, but when you're reading, you have to read it again in a very systematic way, because you're moving towards identifying the original problem. For your own research project, you need to come up with an original research problem. So when you read, you're collecting that information that is going to help you develop that research problem. So the questions that you want to ask yourself is, where did you find this research article? Not just by Googling. It should be from a scientific database. Google might lead you to some of these scientific databases. That's perfectly fine. But random pieces of information doesn't help. It has to be from an authorized organization, because you can get articles from Harvard Medical School, Cleveland Medical Center, National Institute of Health, Indian Council of Medical Research. There's many sites which are valid that can provide you information, and they will lead you to research articles. So you need to know, is this authority in this area, right? Was it peer reviewed? Meaning, have people, other experts in this field actually read this article? When you go through research and you publish your data, it's actually sent anonymously to a group of people. They take away all the names and your affiliations, and they send it to a group of people who are completely unbiased and who are only going to evaluate the content, right? The validity and reliability of your content, right? So that is the most robust way to get your article published. And the articles that you read should have gone through that process. Does the article have a stated research question? Right? Or because you're trying to answer a problem, does the author who's written this article, have they stated what their original question is, right? And why this is important is because you need to identify what is the focus of this entire article, not just random rambling of ideas and questions, right? What is the exact focus of this article? Next is understand what are the data collection methods that are primarily described. I'm not saying it's a primary data collection method, which we will discuss later, the different types of data collection methods. So is this article using direct primary data collection, or is it a collection of other studies like systematic reviews, right? You will see systematic reviews, scoping reviews, where they collect information from other articles and they write an article. There is an entire science behind doing systematic reviews. There's a lot of statistical processes. But you need to distinguish what you're reading, whether you're reading a primary data collection work, a report of that, or you're reading a systematic review. Next is the article logically organized, easy to follow? Are they just jumping around, right? And again, I go back to this idea for you to start paying attention to all of these processes, because eventually by answering your own original research question, you are going to write up something. You're going to write up a thesis, a dissertation, a project, report, or hopefully get published. And you need to know how to organize your thoughts in a logical way. When you read an article, don't assume just because it's been published, it's been well written. Be critical. Think of how you would reorganize it so that it makes sense, that it's easy to follow, right? Does the article provide a background, right? When you start reading articles, the first thing is they talk about introduction, background, significance. Now, are these background, the studies mentioned in this background, are they actually relevant to the question that is being answered? Also remember, if you're reading articles that are kind of close to the original problem that you're trying to address, this background section provides you the additional information that you need. You can use the background information to do your own search when you start writing your paper. Very, very critical is number 7. Are the procedures clearly explained? Remember, I told you that research has to be replicable, right? Under the same conditions. And the only way you can replicate it if the procedure is explained correctly, clearly, accurately, and completely. There are many, many papers that write a methodology section that you really don't know what exactly they've done. And methods are not only about what is the data collected and from whom it is collected, it's also about how they have handled the data after they have collected. So the procedures and the process have to be clearly explained, and you have to critically be able to evaluate whether this has been done clearly, whether the procedures have been written up clearly. And you're going to see how is the data collected, processed, and analyzed. Like I just mentioned, when you read the procedures, the data management and the data analytical plan should be very clear. Finally, the most important part of all of this, do you agree with the interpretation of the results? If you don't agree, what is the reason you don't agree? Do you think more results are needed before this interpretation can be drawn? Are they making an accurate interpretation of the results, right? So because interpretation of the data is the fundamental job of doing research, right? It's the fundamental basis of doing research. So if that interpretation is not correct, you're just coming up with an idea that's really not valid. So when you start reading, I hope you'll use this checklist, and you can kind of have a really gain a lot out of reading your research article. The next thing that I'm going to talk about is identifying this original question or stating the problem and understanding the purpose statement. There's many terminology that is thrown around here, right? What is a problem statement? What is a purpose statement? Why should I know all this? Like all seems to be sounding the same. So let's begin with an example. Let's first start with a problem statement. Whatever you write, whether you're writing a problem statement or a purpose statement, it's absolutely essential to be clear, complete, and concise, right? So here is a problem statement. It says HIV and oral disease. What does this mean? Is this a good problem statement? No, right? Because it doesn't tell you anything about what this person is trying to understand about HIV and oral disease. Now let's look at a better well-written statement, a problem statement. HIV-infected persons are living longer, and it is important to determine to what extent does HIV influence oral disease progression. As you can see very clearly, that earlier statement, HIV and oral disease, doesn't shed any light on what the problem is. But now we know people are living longer, and when they live longer over a period of time, HIV, which is an infectious disease which can cause inflammatory changes, does it have an effect on oral disease progression, right? So now you know what is the gap that you're trying to answer. So you need to, the problem statement that you create has to identify a gap, and the problem statement should address that gap. So there is a gap in an understanding of oral disease amongst people who are HIV infected. And especially now that they're living longer, their exposure to the inflammation is more. So how does it affect oral disease progression? But the problem statement is couched, it's located within this greater purpose, right? The overall purpose is what? Is to understand. Basically, you're comparing oral disease progression among patients with and without HIV. You want to understand overall about oral health. In fact, the purpose statement here could be better written as compare oral health among patients with and without HIV. So within this global big umbrella of oral health, you are talking about oral disease as in periodontitis or whatever else, right? Whatever the kind of disease that you want to study, right? So here on the right is the bigger picture, and on the left is what you see is the gap that has to be addressed within this bigger picture. It's absolutely critical and essential for you to understand the difference between these two, because it's going to make your life so much easier. Because if you know what the problem is, if you have identified the gap, the next steps become fairly easy. I'm not going to say it's going to be completely easy, because now you know what you're measuring. If you don't know what exactly you're measuring, I have seen students who come to me, they've already collected the data, but they have not asked, what is the question that you're trying to answer here? Because if you start just looking at data already collected, or you start collecting data, you will find million answers, million questions. But what is the question that you are interested in, and what is this particular paper trying to understand, or this particular project trying to understand? Okay, so this is not just for writing papers, it's for getting funding, because here in the United States, which I think is also changing very much in India, there's a lot of emphasis on conducting research and academic institutions supporting research. So if you have written a very clear, unique problem statement, your application sets itself apart, right? People know what exactly you're planning to do, and that itself is the first step. That you've already broken through many other people's applications which are not clear, right? So just be very, very clear about how you write the problem statement and the purpose statement. Now, one other aspect of doing research is these big umbrella ideas, right? These big purposes have to be broken down into problem statements, which can be further broken down, right? Bigger problems like oral health. Okay, let me study about gum disease. Can I study about salivary glands? Can I study about something else, right? And can I study about with a certain population, whether women, men, children, different subpopulations, sub-problems can be explored. And you develop a hypothesis for each of these smaller problems. Hypothesis is a word that you will constantly come across while you're doing research, and we'll discuss that further. And so for each of these problems, if you propose a hypothesis, you develop a hypothesis, and you test the hypothesis, you answer several small problems, and several hypotheses that are tested lead to a theory. So when you're doing your research, people will ask you, what is your theory? Well, you don't know what your theory is. You only know what your hypothesis is, right? You are answering, you're testing your hypothesis to either support an existing theory or you're contributing to the building of a new theory. So remember, so let's first look into what hypothesis, and then we'll kind of bring hypothesis and theory together. What is a hypothesis? Hypothesis is nothing but an educated conjecture. Basically, you are proposing an explanation. You are supposing that this could possibly be true. And you are writing it in a way, you're stating it in a way so that it can be tested, right? It is used to test that problem statement, right? So your problem statement that we actually first saw in a couple of slides ago is HIV-infected persons are living longer, and it is important to determine to what extent does HIV influence oral disease and progression. Now, to test this, there's a couple of ways you can write the hypothesis, right? So one way is that I hypothesize, or we as a research team hypothesize, that HIV will accelerate oral disease progression. So I'm saying this is going to happen. So I'm going to test and see whether this is going to happen or not. And then I can accept or reject my hypothesis saying, oh, okay, HIV doesn't accelerate or does accelerate. I don't know the answer at this time, right? Because we are just going to answer this question about the role of HIV in oral disease, right? Or there's a different way of writing, which you would have heard several times if you already have taken any classes in statistics, is the null hypothesis. We hypothesize that there will be no difference in oral disease progression among HIV positive and HIV negative individuals. Again, what you set yourself up for is a very good thing. You are setting yourself up to compare, to measure two different things, to measure it and compare. Only if you say one thing is different or no different, then you have certain parameters to compare it. And by comparing it, you can establish whether what your problem statement is true or not, right? Remember, when you do several hypotheses like this, for example, let's again go back to oral health. So we have this global idea, okay, HIV and oral health, right? We say like HIV may cause, what is the influence of HIV on oral health? So the different hypotheses could be HIV itself is an inflammatory disease, and inflammation, chronic inflammation, can cause changes in oral health. Or people are aging-related issues can cause changes in oral health. Medications that are used to treat HIV can trigger a reaction that can cause changes in oral health. Or people who have been infected with HIV, they're more depressed, they're coping with a lot more stresses in life. That could cause oral health issues. Or there is a stigma about HIV, and they don't access the healthcare system or don't access resources to get themselves treated, and that can also damage their oral health, right? So there are several hypotheses that at this time I actually stated 5 different hypotheses that you can test out, right? So it's 5 different problem statements. Each of them can have a hypothesis, and you can understand what is the theory. By answering all of that, you develop this theory towards understanding oral health among HIV-infected populations. I hope I'm not going too fast, but at least, and I don't see the chat box, so if I'm going too fast, mention it in your chat box and Dr. Ramya or somebody else could alert me. So in today's agenda thus far, we've talked about the definition of research. We've understood about how to find a problem, state the problem, and to state the problem within the big umbrella of the purpose of the research project. We've also learned about how to answer sub-problems, develop several hypotheses so that you can eventually contribute to developing a theory in addressing the problem. Okay, now let's delve into the next big piece called the methodology, right? So as you can, the methodology is the absolute essential piece because you want to have replicable research, valid research. Your processes have to be clear, right, and correct. So within methodology, there's 4 big pillars, right? And actually there is a 5th big pillar. I modified Kasdan's diagram because I believe the other part, the last part, is not totally a methodological piece. So I've kind of taken away the last part, but I will explain that. The last pillar is the research design. The first is the research design. The second is the assessment. Third, very, very important, ethical issues and scientific integrity. And 4th is the data evaluation. Okay, let's begin with the research design. When we talk about research design, it's basically what is your plan on how you're going to answer this question, to examine this question. How are you going to test the hypothesis? What are the plans that you can use? How should this be done so that I get the right answer to my the research question that I have raised or the problem statement, right? Now, we'll go again more depth into research design. But the next big pillar in methodology is the tools that you use to collect the data. Again, there's a variety of tools, variety of data. We'll talk about that. And ethical issues and scientific integrity. It's absolutely essential to protect research participant rights because research, unless you are doing a clinical trial where it's a terminal end-stage disease and you're enrolling participants who are going to get some benefit, most often research doesn't provide any direct benefit. Even amongst those participants who take part in cancer research or terminally ill patients who take part in research, they may not benefit. They may die before the findings come out because it takes a lot of time to collect data before you can publish it, right? And say this is going to help cure or prevent the disease. So they are providing their selves, their whole human body, their intellectual abilities, their functional abilities, their biological samples to answer some question they may not benefit. So the research part is going to absolutely be handled with a lot of respect, and you have to protect their rights. And there is a responsibility of the researcher too. It's a scientific integrity. You may be working with teams. People might be doing things that are not right. And as a researcher, because your goal and your role is much bigger than that particular data, you are actually developing questions and answering them that's going to affect a huge population's life or people's lives. So there is a certain responsibility that the researcher carries, and it's really important to maintain the scientific integrity of that, right? Next, of course, which is the most challenging for many students and for many people who do research, is the data evaluation. What are the techniques that you're going to use? You have some data. How are you going to characterize this data? How are you going to describe the sample? How are you going to explain what is happening? Basically, all the statistical analysis that helps you answer the problem, because you have a whole bunch of data, but you have to do a lot of calculations before you can understand and answer the problem statement. So let's begin with research design. If you Google research design, or if you have a research design textbook, you will have several different designs presented. I'm just going to talk about the few that are repeatedly more often used, and it's used in medicine and public health more often in healthcare settings. So the first, and I feel one of the easiest ways to do research is to do a cross-sectional study, right? You gather a group of people, you ask them to answer some questions, or you collect data from them, whether it's just questions or samples or whatever else. So you are collecting from a cross-section of the population. And this provides a snapshot. It's like taking a picture at that moment, right? Of the characteristics of that sample at the time, right? When I mean there is no time dimension, what I mean is this characteristic that you are trying to study might have been caused by something else. We don't know whether this entire cross-sectional sample has been exposed to that event or not exposed. We don't know when they were exposed, whether they have been exposed, whether they have not been exposed, when they were exposed. We don't know anything about that. So there's no time dimension. So you cannot provide causality when you do cross-sectional studies, right? But it's a good way to estimate the prevalence of disease at the time. Number of COVID patients between April and May 2020. That's a cross-section of a time going to a primary health center in India, tested for COVID, positive. That's it. We know at that point in time, that was the prevalence of the disease in that area, in that neighborhood, in that clinic, at that time, right? What cross-sectional studies help you do is to collect data from a large group of people. So at one time shot, you can send a survey. You can send a survey to thousands of people. You can ask people to line up to give a sample of blood, and you can just do a one-time large collection, right? And you can focus it within a certain characteristic, right? You can say, oh, everybody who wakes up between 7 and 8 in the morning, or 5 and 6 in the morning, turn up, and I want to study your sleep and wake patterns, right? Or everybody who flosses every day or brushes the teeth every day at this time, turn up, and I want to collect data from you. So you can collect it from a large group of individuals and focus it with a certain characteristics. You can limit the sample to a certain characteristics. The other very robust research design is longitudinal. As the term implies, it's longitudinal. It's looking forward, right? Repeated measures over a period of time. There is prospective longitudinal and retrospective, but I'm just going to stick to the prospective side for now, because that's the most common thing, common research design that we use. And basically, you're repeating the measurements over a period of time. What this allows you to do is to identify patterns of change. If you're measuring the same thing over a period of time, you will see when changes happen, and it helps you establish the direction of the relationship. Meaning, for example, right now I am involved in a longitudinal study that follows, asks questions every 6 months to a group of people. We ask them a lot of questions about their behaviors, their smoking behaviors, alcohol intake behaviors, their respiratory health. And we've been collecting this data since 2009. So we have a tremendous amount of data, and now it's easy to see patterns. When you go back and see, you will see as a group how people responded, as individuals how people changed their patterns. And then you can see what the relationship between these different characteristics are. So one characteristic, which in research terms is called a variable could be smoking, or a variable could be cough, a variable could be shortness of breath, a variable could be anything. And then you look for the relationship between these different variables and how it changes over time, right? Experimental is, again, randomized clinical trials, right? Experimental, as the term indicates, is when the researcher is able to control the situation, meaning you collect a group of people, you expose them to something. So it's in a very controlled environment, and then you see what the outcomes are. So you do a pre-post design, meaning you first collect some information before anything is given to them. It could be a medication, it can be an educational piece, it can be something as similar as a brochure. For example, let's say it's a dental clinic. And what you do is you just take a group of people and you ask them a bunch of questions about oral health and how they maintain their oral health. You examine them, you collect data. Then you can give them just a brochure, right? You can give them a brochure about how to maintain good oral health. And then you measure their oral health again and the change in attitudes, their knowledge about oral health. Now, in an experimental design, you're going to have a group of people who are going to get this information and a group of people that are not going to get the information, a randomized controlled trial, right? You're randomly going to select people who are going to get the brochure, the another group that is not going to get the brochure, and then you measure them before and after, and then you can see whether this brochure really has some impact. If you give them a brochure, if you give them some information about maintaining good oral health, is that information, you're measuring the impact of the information, right? Does it have any effect, right? So it establishes causality, right? Again, within certain limits, which establishes causality. In drug trials, this is very common. There is a disease, people get the drug, we see whether they're cured from the disease, and the people who have the disease but don't get the drug, if they have poorer outcomes, then you know that the medication is really helping. So time priority is there. So it's at which point in time you have given, after the onset of disease, you've given the medication. So you can know that the cause is the disease has happened and the medication has been given, and then you have the outcome. In experimental designs, you can also identify the risk factors, right? Sometimes you randomly allocate individuals and just follow them, and they develop a certain risk factor. They're exposed to certain thing, and then it causes the disease. For example, you can have a group of people who are same and have similar characteristics. You follow them up, and then they have a certain risk factor, certain behavior that results in causing a disease in them. And the people who don't have that exposure don't get the disease. Cohort studies, right? Again, cohort is conducted over a period of time, and cohort is unified by a common factor. For example, smokers, right? You take a group of smokers and you follow them up, right? And you follow them up and you study their risk factors over a period of time. You and see whether they develop a disease like COPD or lung cancer. Open cohorts. They allow participants who have the common factor to join over a period of time, meaning we started the study in 2009 and we're still enrolling participants. It's an open cohort. Closed cohorts are participants with the characteristics are enrolled and the study is closed. You decide that in this 1 year period, I'm going to enroll 1,000 participants with this characteristics, and that's it. That is the only sample that I'm going to follow up over a period of time. So that's a very stable sample, and you just need to follow them up over a period of time to see whether they're having any new risk factors that is developing, they're exposed to, or things are changing. What are the patterns of change? Case control is another very interesting way of answering a problem statement. Case control almost looks at the historical data. It actually does look at the historical data. So you select a patient with an outcome of interest, or a group of patients with an outcome of interest, and a similar group without the outcome of interest. Let's say, again, some breast cancer, right? And then you select women who are attending a breast cancer clinic at a certain location. They already have the outcome, right? And then you select another group of women who are completely matched in similar demographics, right? Age and socioeconomic status, educational, right? Attainment. Then you go back and they are seen at the same clinic. Perhaps all these women are coming for a screening mammogram. Some of them have breast cancer, some of them don't have. Then you study the historical factors. You go backwards and you see, oh, what were their different exposures? And you see whether there are differences between the people who have the breast cancer and the patients who don't have the breast cancer, right? So those are some of the research designs. But if you most often, most often I've noticed students who are going to start a research project as part of the degree program or starting the research career, usually they go for a cross-sectional study, which is totally fine because it's so much easier to learn so many different pieces of the research project by doing cross-sectional studies. Some students venture out to look at data from longitudinal studies because, like, as I said, from 2009, I have data. So there's some people who will come and say, like, I want to, analyze the data. So we talked about research design. Now let's talk about the assessment. Assessment is tools that you use to collect the data, right? So you can collect different types of data in different formats. This is just some examples that I were provided, right? You can do an entire study just understanding demographic data, gender, age, employment, income, health insurance, right? You can get survey responses on self-reported symptoms, knowledge, attitudes, and behaviors about certain things. You can collect clinical parameters, medical abstraction you can do, pulse, blood pressure. You can collect biological samples and analyze them. And as I mentioned, you can do a medical chart abstraction, not just of clinical parameters. You can also do admission, discharge patterns, emergency room utilization, medication utilization, right? There's many different sources of data. But each of this data is going to be applicable, only one of them or some of them are going to be applicable for the problem statement that you are trying to answer. If you're going to answer the question of oral health utilization among women between 30 and 40 years of age in this primary health center or this dental clinic in a particular village in India, so you are going to look for ER utilization. You're going to see how the gender, age, employment, and income affect ER utilization. You're going to see the knowledge and attitudes about ER utilization. You can, understanding the ER utilization, you actually know their behaviors also, right? So one or more can be used to answer that problem statement that you have. Now, let's look at this qualitative data also, right? Self-reported symptom history is qualitative. You can collect information in other ways, not just quantitative data where it's very structured, where there's numbers, where there are response categories. And qualitative data gives you a better understanding about the meanings of behind people's experiences, right? So if you want to understand meanings about traditional healing practices in a specific group, right? Why do people go to healers rather than go to doctors? What is the meaning of having an illness like breast cancer? How do they deal with their health? You can do a qualitative study. You can study images, x-rays, CT scans, right? And some of this qualitative data can be quantified. So there are methods in which you can transform these qualitative data to quantitative data. But what I'm trying to emphasize here is assessments are done to collect quantitative data or qualitative data, and you have to use the right tools to collect this type of data. So again, data can come from primary sources, directly collecting from the source, or it can be a secondary data that has already been collected, like medical chart information, electronic medical records, and you extract, and you can use that for your understanding of your problem statement. Quantitative data can be collected, again, as I mentioned, through surveys, biological sample, medical chart abstraction, and just observation. Qualitative data, you can conduct one-on-one interviews, you can conduct focus groups, and there's other many techniques that you can use to understand qualitative data. So thus far in methodology, we talked about research design. We talked about the various tools and the various ways in which data, what are the different types of data that has to be collected. And now let's look into the ethical issues. When you start your research projects or research careers, I trust that you're going to have a research committee or an advisor who's going to guide you through this process. Right? It's really critical that both the committee and you are on the same page of what is going to be done. So it's essential that you develop a proposal with your problem statement. The statement, the larger purpose under which this problem statement is being explored. You state the research design. I'm going to do a cross-sectional study, or I'm going to do a cross-sectional study within a longitudinal study, or I'm just going to do a randomized clinical trial. And these are the tools, in the sense I'm going to extract data from medical charts, or I'm going to collect biological samples. These are the tools that I'm going to use to address my problem statement. You can include a preliminary data evaluation method, and I totally encourage everybody to talk to the statistician even before you start your research project. Please, please, please do that. Talk to your statistician, get their input. They will tell you how to set up your data collection methods so that you can answer that question that you have correctly, right? Of course, get your research committee approval. They'll make changes, work with them, get it approved. Over here in the United States, we have the Institutional Review Board, and I know that in the past few years, even in India, the ICMR and different, as an entity for India, and different academic institutions have the research committee approval process. You have to present to them your data collection tools. What is the information that you're going to provide to their research participant? It could be your patients. So how are you going to ensure confidentiality, privacy, and safety of the data? How are you going to explain the purpose of the study to them? How are they going to understand how this data is going to be used? What are the risks and benefits of participating in the study? For example, if you're going to do an oral exam, what are the risks? What are the benefits? Is there no benefit at all? How can they contact you if they have any questions, right? So it's really, really important that to answer all these questions while setting up your proposals, your projects, and your plans, so that you are addressing the ethical issues and you're also ensuring good scientific integrity. You're completely transparent about the process. Your process is accurate. You have consulted with the statistician, so that I know students who try to change some of the data post collection. That's wrong. You cannot do that. So you can prevent yourself from doing that by talking to the statistician ahead. Maintain scientific integrity. Okay, consult. So data evaluation, right? Data evaluation is the statistical piece to the whole project that you've done thus far. So basically, when you start your research project, I highly encourage you to start with a pilot. If your sample with the statistician you will design, I'm going to talk to 100 patients. Perhaps to answer your question, you need to talk to 100 patients, right? But you can pilot it with the first 5 patients, right? And see how this is working. Are these questions that you ask, are the information that you're providing, is the medical abstraction that you're doing, is that making sense? Is it providing you the data that you need? Okay, is it accurate? Is it complete? Work again with the statistician to identify missingness and completion rates of the data that you're collecting. People think that to get into EMR, electronic medical records, and they can just extract data. There will be a lot of missing data. Everybody doesn't enter the pulse and the blood pressure. Simple physical parameters, vital parameters, people don't enter. So then how are you going to deal with that missing data? So early on, when you are working towards your research project, after those 5 patients or research participants with whom you're piloted, check for missingness, completion rates, and keep checking at regular intervals. At the end of 20 participants, at the end of 40. If you get to the 100th person and then you're going to look at your data, you're going to look back and say, oh my God, I should have done this beforehand, right? I missed collecting this information. Now I cannot call them again or ask them to provide this information again, right? Another big important part of data management is data cleaning, recoding, and organizing the data. It's data that you collect has to be, most often it's converted to zeros and ones for you to do the analysis. And that is a process that you have to do with your data manager or with your statistician. They will tell you how to go about collecting, cleaning, and recoding and organizing the data. And if you're not familiar with it, please you can sign up online. There are many, many courses available on basic data cleaning, basic data handling software, right? Like SPSS, SAS, data, Access, and Excel. You can use Excel spreadsheets and do wonderful work. So learn the techniques, learn the tools, right? So watch videos. There's many resources available for you to learn how to clean, recode, and organize the data. Because what that does is it really sets you up for success when you run your statistical analysis. Everybody, they collect the data and they immediately want to do analysis. No. You really have to process the data before you come to this point where you can do this analysis. Begin with your summary statistics. Do not begin with high-level regression models, multivariable analysis. If you're a beginning researcher, if you're doing it part of your research project, basic summary statistics provide rich information, just the mean, median, mode, histograms, understanding what a normal distribution is. Is this data skewed to one end? That's absolutely rich data. It forms the foundation of your understanding of your data, right? Even measures of association, chi-square tests, understand directionality of the association. If X is causing Y is causing X, you have to learn about significance levels, confidence intervals, and p-values, right? This is not a statistics class. I'm not delving into it, but I strongly encourage you to pick up some statistical knowledge, and not just the statistical, the tools that you use, the software that you use for you to come up with these results. Because the software, you can write a code and you can get the result, but you need to be able to interpret it. Whether a confidence intervals, what does it mean? What is the p-value? What is the significant at 0.05? What is 0.001, right? Which you'll see very commonly in your research articles when you read. So these are some of the techniques you can use for data evaluation. So remember, you did all that, your research design, your assessment, maintaining, getting the approvals, and collecting the data, analyzing the data to answer this problem statement and purpose statement. Don't lose track of this. Remember, this is your final goal. This is where you have to land after all that is done. And you want to, you're testing this hypothesis. So when you do those statistical calculations, it's either going to accept or reject your hypothesis. And I'm not going to go into a lot of details about the null hypothesis and alternate hypothesis and why you accept or reject, because all that is part of the statistical knowledge that you have to gain. But absolutely the end goal of all that effort is to go back to these two processes, the problem statement and accepting or rejecting your hypotheses. Now, so far, I hope I still have some time. I'm 5 minutes over, but I can quickly go over a bit of a small example on how I did my own analysis using these parameters, right? This set of instructions. So before we delve into it, I just want to reiterate the fact that research is a cyclical process, right? You begin with the problem, you set up the clear statement, and you could subdivide the problem, you test out your hypothesis, and more questions are raised in this process, right? You will collect data, and the data will tell you something, and now you're asking yourself another question. Oh, how did this happen, right? So let's look at an example, which I'm currently working on, change in tobacco use in a cohort of smokers before and during COVID. So in my problem statement, I'm stating cigarette smoking causes inflammation in the lungs. COVID was an unexpected stressor that may have affected smoking behaviors, and it is important to understand changes in smoking behaviors during COVID. My purpose is to study the purpose of my study was to quantify differences in smoking behaviors before and during the COVID pandemic in a longitudinal cohort that includes smokers. My hypothesis was there is no difference in the number of cigarettes smoked in a day before and during the pandemic. So this is what I'm finally testing. All this I've said, this is the problem, this is the overall goal, but my final hypothesis is there is no difference. Let's see whether that pans out, right? So I collected data. So I mentioned we have a longitudinal study, and we were doing in-person interactions, but suddenly we had to stop because of the lockdown. So we did a cross-sectional analysis, right? We administered a telephone-based survey, and we just asked them questions about COVID and smoking behaviors during that time. But remember, because this is nested within a longitudinal study, data was collected prior, about 6 months prior, from many of our participants, from a large number of our participants, right? So I did a telephone-based study. Questions were asked about respiratory symptoms, COVID-related symptoms, and smoking behavior, number of cigarettes smoked per day in the week prior. Data was captured using electronic records, like using RedCap. Okay, it was approved by Johns Hopkins Institutional Review Board to ensure confidentiality and privacy of participant responses. So this is the data evaluation. These are my results, right? So I kind of rapidly went through this, but this was a very painful procedure, which took a bit of time because we are in the early phase of the pandemic. And suddenly we had moved from in-person to telephone interaction. And I was doing all of this from my homes rather than going to the office. So data evaluation, basically, I got responses from 438 participants that I analyzed. Let me rephrase that. I received responses from 665 participants, but for this analysis, I'm using 438. This is a classic example of the data management. What happened between 665 to 438? What happened to those 200 plus participants, right? So that's where my statistician helped me understand there was missingness in the data, there was incomplete data collection. And also because we were doing a comparison, it was important to compare with people who had more recent responses before the pandemic, right? So as you can see, my statistician helped me narrow it down from 665 study participants to 438. And it was an older cohort. We already have this cohort that is aging closer to 60 years of age. And these are the breakdowns. About 158 of them were women. And many of them, this is a population that also has HIV, the positive, very high rate. As you can see, for nearly 50% of them are HIV positive. And about 18% have a chronic obstructive pulmonary disease. And 1/3 of them really have other comorbidities, which was a big issue with COVID, right? Diabetes and hypertension. We also asked how concerned they were about COVID. And as expected, a majority of them are very concerned about contracting COVID. This was done in April to September of 2020. So then we asked them whether they had ever reported smoking ever in their lifetime. And the responses kind of remain the same mostly, where, as you can see, the numbers is kind of changed here. About 5 more people said in their entire lifetime that they had smoked. They remembered during COVID that they had some experience smoking, and then they had smoked within the past 1 month. And before and during COVID, it was this almost very close, the same numbers. So this is an example of a histogram. So what it shows is the number of cigarettes smoked per day in the week before COVID and during COVID. This is data that was collected before COVID. As you can see, this is a very preliminary way of looking at the data. I now understand that my data is skewed, right? There's a skew here. So knowing that this is skewed, my analysis becomes different. I use medians instead of means. If you have taken a statistics class, you will understand that when data is more normally distributed, you want to use means, whereas in skew data, it's better because the cutoff point is more centered. So we compared the cigarette smokes, right? So before, this is before, and these numbers are before, and these are during COVID. There were people 19 of them who said they had never smoked in the month prior or before COVID, and then they picked up smoking during COVID. And they picked up about 7 cigarettes. The median is 7, right? The difference from 0 cigarettes to 7 cigarettes. This is the interquartile range. And you see the same patterns like this amongst the 99 people who are light smokers, very light smokers, that is 1 to 4 cigarettes, light smokers 5 to 9 cigarettes, moderate smokers 10 to 14 cigarettes per day, and heavy smokers categorized as more than 15 cigarettes a day. As you can see, there's a significance in the people who really picked up smoking in the month prior during COVID. And there is a reduction over here from 10. The median remained the same, but can you see the range from 10 to 10, it became 6 to 10. So some people were trying to drop the numbers. Again here, 15 to 20 became 10 to 15. So compared to before COVID, during COVID, the lower levels were changing and it was significant. Now, fundamentally, what is my research? This is the final piece, right? Interpreting the findings. What I'm showing here is that most of the people continued smoking the same way. We can see 278 and 277, really not big difference, right? So why is that happening? This is where I start interpreting. It's an older population. They have an established pattern of smoking. Why did some of these people who were not smokers in the month prior pick up smoking? Could be because they were actually on the threshold of quitting. The lockdown created a stressor and they started smoking. There was also some misinformation that smoking was protective against COVID. So perhaps these people decided to smoke, right? And why did these people drop, right? Why is this interquartile range different before and during COVID? Again, perhaps some people thought, well, COVID is affecting my lungs, so let me decrease my smoking, right? Overall, all this supports one idea that in smoking cessation programs, it's better to advocate towards lowering the number of cigarettes slowly, steadily, rather than immediate cessation, because you can maintain adherence. So that's the contribution that I have from my own analysis and my own research on this project, right? So I'm trying to, of course, my study has many limitations. It's self-reported data, and the time frame of their smoking patterns we cannot establish, right? It cannot be authenticated. So as you can see, I have used these tools that I mentioned, like, problem statement, purpose statement, hypothesis, use the research design, use certain assessment tools, maintain ethics and scientific integrity, and conducted a data evaluation to answer the question, this main hypothesis. My hypothesis is supported, right? There is no difference in the number of cigarettes smoked in a day before and during the pandemic, but it is within certain categories, right? Because there is some difference in other categories, depending on the number of cigarettes that you smoke. I know I went a little too fast. If you have any questions, I'm happy to talk to you separately too. And now I'm open to questions.
Thank you, Doctor. Thank you for conveying your knowledge through this presentation. We will go ahead with questions and over to Srimati ma'am for the question session.
Thank you, ma'am. Your speech was exemplary, really interesting, and then it was really well said, ma'am. We have few basic questions from our participants. First question is, what are the key points to be remembered for creating research questions.
Key points to be remembered to creating a research question. First, make sure that the question has not been answered by somebody else. Again, read, right? And a really good research question is very narrow. Don't make it broad. Keep it very narrow. It could be a very small piece. It could be examining some particular characteristic of your patients, right? Define when you're going to do it, how many people are going to be included in this, and basically understand what the restrictive parameters are. What are the limits of your data that you're going to collect to answer that research question, right? Rather than saying, I'm going to understand oral health among all people living in Chennai, you can narrow it down among 50 people who are of this particular age group. This is what I'm going to do. But again, that is totally influenced by the research problem that you're trying to address. And that goes back to, again, reading and finding out that nobody else has answered that question.
Thank you, ma'am. Next is test of significance important in writing research paper?
Okay, very good question. I love that question because you do analysis, no data, there's no significance. Oh my God, it's terrible. No significance is a very, very, very important finding. But to go back to the question, yes, test of significance is essential, because what is the test of significance showing you? Two things. There's two different tests of significance: confidence intervals, p-values. Your p-value is telling you nothing but the fact that the risk that you're taking, that your hypothesis is wrong. You're saying, I am going to take the risk of 1% or 5% to say that my hypothesis could possibly be wrong. I did all that I could, but my hypothesis could potentially be wrong. It could be incorrect. That is the risk the p-value is telling you. Whereas the confidence interval, which is a very different kind of test, is showing you that if you repeated this, if you found a value, let's say the mean weight of a group of people in Chennai that randomly you selected is 60 kgs. I'm just throwing it out there. I'm not saying it's true, right? Of a certain group of people. Now, if you repeat that about 100 times, 95 times you should get the same mean. And that will happen if your sample is random. You are showing through your confidence intervals and p-values a couple of things: the way you selected the sample, the way you measured your sample. So significant tests are essential. But the question to be careful, cautious still, is that don't get stuck on having significance. You have to do the test of significance. But if it doesn't have significance and there is no difference, nothing to worry about. No significance is still a valid test as long as the procedures have been followed. Did that answer the question to whoever asked it? That's a very important question that you asked, whoever asked it.
Thank you, ma'am. Next one is, why study of the same factors gives different result? Reason.
You can study same factors, but you are studying it under a different environment, right? Like, for example, rice eating, right? Eating rice in India is different from eating rice here in the United States. This is just a personal tale, right? This is not a scientific conclusion, because we eat rice there. This is, again, totally personal, totally not scientific. The setting has completely changed, right? My life here is very different. The amount of exercise you do here is very different. The exposures that you have in India is very different. So your results are going to be different. So when you want to replicate results, you want to use the same setting, right? So you measure something in Delhi, you measure the same thing in Chennai. It's going to be different. It's two different populations. Their diets are different. Their environment is different. Perhaps the information they're getting is different. And that is just from the social sciences. If you look at clinical biological parameters, right? height, weight, oxygen concentration, hemoglobin concentration. These are all very different for different people. So it's very important that when you try to understand the impact of a particular factor on a group of people, that you are measuring, comparing it with another group that is very similar in the demographic characteristics, because that's when you really know whether the factor is working the same way or not. Again, does that answer the question to the person who asked it? Good question.
Yes, ma'am.
Good
Thank you,
questions.
ma'am. Thank you, ma'am. Next
Yes.
one is,
Anything else?
is there any difference in qualitative and quantitative research tools and techniques, ma'am?
Yes. So quantitative, which I encourage this person who asked this question to actually Google that very question that you asked, because there is a lot of information that I cannot cover in the next minute or so. But there are many, many textbooks that will shed information on this in detail. So let's talk about quantitative. Quantitative, in very common terms, is numbers based, right? If you ask a question, how likely is it that you are going to brush your teeth every morning, right? You say very likely, unlikely, somewhat likely, right? So that you can convert it into numbers. Very likely could be 3, somewhat likely could be 2, unlikely could be 1. So you quantified it, right? Is this person male or female? 0, 1. Male quantified as 0, female as 1. So the quantitative data helps you analyze numbers. Now, qualitative data, on the other hand, is more about just for your understanding, which I don't quote me on this totally, is that it's more of a greater, broader understanding by asking questions about meaning of things. Let's say a person comes with a terminal illness. Yes, they have cancer, they don't have cancer. Yes, no is a quantitative. But their experience of living with cancer or living with some other disease, how does it affect their social life? How does it affect their work? How does it affect their family life? Those are rich questions, and you have to, like an interview, right? You see interviews on television all the time, or on TikTok or in Instagram or whatever. So those are rich, detailed explanations of how people are functioning in their lives with a certain disease or their experience of the disease. So that's the difference between quantitative and qualitative. Now, sometimes qualitative data is again converted to quantitative, which can be done. You take a set of responses, or 5 people said this is how. Like, for example, how did you feel during COVID? 5 people said that they had a lot of fear and anxiety. They had to, some people said there were other economic stressors. So you can kind of, again, form like bins based on the qualitative research. But the basic difference is quantitative is focusing more on collecting data that can easily be quantifiable, made into numbers, whereas qualitative is a broader meaning, the background and the experiences of the individual.
Thank you, ma'am. One more question, ma'am. When should we compare our research, ma'am? Which stage do we have to compare our research with others' finding, ma'am?
Well, it's not at a stage. See, what the question is asking is, you're comparing the results of your findings, right?
Yes, ma'am.
If you have done a truly random sample, if you have done all of the procedures, as you go along and you write your results and you go back and look at the manuscripts that you've already read, at that point you will see whether it's completely different from their experience, their results, than yours, right? For example, in my finding, I noticed that some people had increased cigarette smoking, some people had decreased cigarette smoking, right? And so then I looked at the other research when I'm writing the discussion piece. What does the results show? There are studies that show that the number of the cigarette sales went up. In the United States, I'm talking, right? Absolute numbers of cigarette sales went up during the period during lockdown. So I've compared my finding of increase in use of cigarettes to increase in cigarette sales, right? So my finding makes sense now, right? So my finding says, oh, more people are smoking actually during this pandemic, and I can compare it with cigarette sales that demonstrated. There was researchers in Boston, they did the study and they found the cigarette sales went up about about close to a half a pack increase in sales, right? So that's when you compare to see whether your results are valid. Sometimes your results might be completely different from what the other research says, which is totally fine as long as you have followed the procedures. Research is about answering the unknown, right? So if you have followed the procedures, you can still stand on firm ground and say, I have followed my procedures. My findings are different from your findings. So be it. But this is the reason why it is different, because my population is different. The time I measured is different. The questions that I asked is different. So you can do your comparison. Your comparison will start at the methodology phase when you read the manuscript and you see their procedures and you look at your procedures. Right there, you've done a comparison. Then you collect your results and you look at your results and their results, difference. Then you look at the discussion, like, your interpretation of the findings, different. So you can do it at multiple stages.
Thank you, ma'am. Thank you so much. Thank you for this encouraging and motivating lecture, ma'am. We have clear picture of research, actually, how to write the research and what are the points to be remembered during research design, what are the tools for evaluation, or all those. Really informative, ma'am. Thank you so much. Thank you for accepting this invitation. Thank you once again, ma'am. On to Ramya again.
Just to add, it's a total pleasure. I live here in the United States and I love teaching, and I'm very interested in talking to youngsters who are getting into this career of research or just doing a research project. Thank you for the opportunity, Dr. Jones. It was really, it was really helpful for me too. So I hope it helps others. And email me. This is my email. If you have any questions, if you want me to talk to you, we can set up a time with anybody who's kind of starting off. I have a very limited time, but I'm happy to provide service to my colleagues in India.
Thank you, ma'am. Thank you so much. Ramya?
Thank you, doctor. Thank you for explaining all the questions and for the informative presentation. Every participants and beginners could have benefited with every detail on the steps of research process. Thank you so much. I would also like to thank the institution, Sri Balaji Dental College and Hospital, Dr. Sumati Jones, Head of the Pharmacology Department, for conducting series of webinar on Dentopharm 2022. Principal, Dr. Jimson Sir, and Organizing Committee, Dr. Satish and Mr. N.P. Murli. A special thanks to Dr. Nisha Sheikh and Angelin from DocMode Organization for the technical support. And thank you for all the participants for participating. Thank you.